lastly, let's look at the physical methods. The physical methods to prevent blood clotting. So, physical methods to prevent blood clotting includes cold, collecting blood in a container with smooth surface. Yes, what about cold? Reducing the temperature to about 5 degrees Celsius will delay the coagulation of blood. Okay? And then collecting the blood in a container with smooth surface like the silicone-coated container prevents clotting. How? Because we know the smooth surface, they will inhibit factor 12 and the platelets. So the formation of prothrombin activator is prevented. Now, what are procoagulant? Not anticoagulant. Procoagulant, those that promotes coagulation of blood. We have proagulant hemostatic agents, which accelerates the process of blood coagulation. But we saw that heparin and thrombomodulin, they prevent coagulation. But the procoagulant, they accelerate blood clotting. One of them is thrombin. Thrombin is sprayed upon the bleeding surface to arrest bleeding by hastening blood clotting. We also have snake venom, such as that from the vipers, the cobras, the rattlesnakes. They contain proteolytic enzymes which enhances blood clotting by activating the clotting factors. We also have extracts of lungs and thymus. That is, the extracts of lungs and thymus has thromboplastin, okay, which causes rapid blood coagulation. Thromboplastin, we say it is a tissue factor. And then we have sodium or calcium alginate. This enhances blood clotting process by activating the Hodgman factor. And then we also have oxidized cellulose. This causes clotting of blood by activating the Hodgman factor. Now, we need to know also what we call the test of blood clotting. Blood clotting tests are used to diagnose blood disorders. Blood disorders like purpura, hemophilia, and von Willebrand diseases. Okay, so you can measure bleeding time, you can measure clotting time, you can measure prothrombin time, you can measure partial prothrombin time, you can also measure international normalized ratio, which is called INR. You can also measure thrombin time. So let me explain these things one by one. What is bleeding time? What is bleeding time? Okay. Bleeding time, okay, we know bleeding is losing blood, eh? It's a time interval from the oozing of blood after a cut to the arrest. Okay. You can ask, how long did the person bleed? How long did it take the bleeding to stop from the time the person was injured? So that's called the bleeding time. So usually this one is determined by the Duke method using blotting paper or filter paper method. I will not explain this, we'll explain this as we move on. The normal bleeding time is between 3 to 6 minutes. However, it is prolonged in purpura. Okay. Purpura is a rash of purple spots, okay, due to small blood vessels leaking blood into the skin, into the joints and intestine. It is prolonged. So purpura, it's a bleeding disorder. And then we have clotting time. Now, what is clotting time? Okay. Remember, clotting time is the time interval from the oozing of blood after a cut or injury till the formation of a clot. It is usually determined by the capillary tube method, and the normal is 3 to 8 minutes. It is prolonged in hemophilia. This looks the same, clotting time and bleeding time. Do they? Okay. Because clotting time, you are saying, it's a time interval from oozing of blood after a cut or injury until there is arrest of bleeding. But that is bleeding time. It's a time from injury until there is arrest of bleeding. But clotting time is a time interval from oozing of blood after a cut or injury till the formation of a clot. Okay, that's why when you look at this difference, the time is 3 to 8, but bleeding time, we say it is 3 to 6. Okay, they are somehow similar. And then we have prothrombin time. Prothrombin time. We know the function of prothrombin, We know it. It is produced from prothrombin activators, converting prothrombin to thrombin. So what is prothrombin time? It's a time taken by blood to clot after adding tissue thromboplastin. It's a time taken for blood to clot after adding tissue thromboplastin. We know tissue thromboplastin activates the extrinsic pathway where there is formation of prothrombin activator, which is required to the activation of prothrombin to thrombin. Okay. So blood is collected in and oxalated so that the calcium is precipitated and prothrombin is not converted into thrombin. So therefore, blood clotting is prevented. Okay. So then a large quantity of tissue thromboplastin with calcium is added to this blood. Calcium nullifies the effect of oxalate. The tissue thromboplastin activates prothrombin and blood clotting occurs. Okay, so during this procedure, the time taken by blood to clot after adding tissue thromboplastin will be determined. Prothrombin time indicates the total quantity of prothrombin present in the blood. Okay, so the normal prothrombin time is 10 to 12 seconds. That's a normal prothrombin time. So it is prolonged in deficiency of prothrombin and other factors like factor 1, factor 5, 7, and X. However, it is normal in hemophilia. So prothrombin time is very important just to assess why this person has bleeding disorders. Okay. The other one is called partial prothrombin time or activated prothrombin time. Partial prothrombin time or PPT is the time taken for blood to clot after adding an activator such as a phospholipid along with calcium to it. It is also called activated partial prothrombin time. This test is useful in monitoring the patients taking anticoagulant drugs. Okay. It is carried out by observing clotting time after adding phospholipid, a surface activator, and calcium to a patient's plasma. So phospholipid, we know that it serves as a platelet substitute. Commonly used surface activator is kaolin. Okay, so what's a normal partial prothrombin time is between 30 to 45 seconds. Okay. It is prolonged in heparin or warfarin therapy. Why? Since the heparin and warfarin inhibit clotting. That's why it is prolonged. And deficiency or inhibition of factor 2, 5, 8, 9, 10, 11, and 12. Okay, I want you to go and think about these things. Then we have the international normalized ratio. This is the rating of a patient's prothrombin time when compared to an average. This is the rating of a patient's prothrombin time when compared to an average. We know prothrombin time is a time taken by blood to clot after adding tissue thromboplastin. So we are comparing the patient's prothrombin time compared to the average. So this one, it measures extrinsic clotting pathway system. Okay, INR is useful in monitoring impact of anticoagulant drugs such as warfarin and to adjust the dosage of anticoagulants. Okay, the normal IR is 1, is about 1. So if IR is maybe 2, it means blood takes longer time to clot. Okay, in patients taking anticoagulant therapy for atrial fibrillation, for example, INR should be 2 to 3 because blood should take a longer time for it to clot. Okay, but INR greater than 4 indicates that blood is clotting too slowly and there is a risk of uncontrolled blood clotting. Okay, we'll still come back to this. We'll see the application of this calculation. The other one is called thrombin time. Thrombin time is the time taken for the blood to clot after adding thrombin to it. It is done to investigate the presence of heparin in plasma or to detect fibrinogen abnormalities. This test involves observation of clotting time after adding thrombin to patient's plasma. The normal is 12 to 20 seconds. It is prolonged in heparin therapy and during dysfibrinogenemia, that is abnormal function of the fibrinogen with normal fibrinogen levels. Okay. So some disorders associated with platelets, we have the hemophilia, purpura, and von Willebrand factor. I'll define these. I'll say hemophilia. I'll start by defining hemophilia. This is a group of sex-linked inherited blood disorders characterized by prolonged clotting time. Okay. And then this other one, which is called purpura, is a disorder characterized by prolonged bleeding time. However, the clotting time is normal. And then von Willebrand disease is a bleeding disorder characterized by excess bleeding, even with a mild injury. This is due to deficiency of von Willebrand factor, which is a protein secreted by the endothelium of damaged blood vessels and the platelets. We know that this protein helps in the adherence of platelets to the endothelium and therefore formation of platelet plugs. Okay, so these are the diseases. We'll discuss in more detail when we do things like internal medicine. Thank you very much.